Can lasering the retina lead to macular pucker? Let's talk about it. Hi, my name is Zach Oki. I'm a retina specialist here in Irvine, California. The answer to the question is not likely, maybe, but other things that lead to laser definitely do. What I mean by that is that the reason why macular pucker develops, otherwise known as an epiretinal membrane or a piece of scar tissue on the surface of the retina, is through an event called a PVD. PVDs, or posterior vitreous detachments, are events in which the vitreous gel separates away from the retina. That stimulates a whole set of biochemistry, which then stimulates the formation of an epiretinal membrane. The other thing that can happen from a PVD is a retinal tear. So if someone has a retinal tear, then the retina specialist will laser it. But it just so happens that a PVD also causes an epiretinal membrane. So someone might walk away with the impression that, oh, I got lasered and therefore I have an epiretinal membrane, when we know that's not likely accurate. And the reason why we know that is because the overwhelming majority of people who have an epiretinal membrane underwent a PVD without a retinal tear and therefore were never lasered. Now remember, just a second ago I said maybe. What do I mean by maybe? What we think is that if we laser the retina, what are we exactly accomplishing? We're telling the immune system, hey, why don't you go over there where the laser was applied, get a little excited, and form some scar tissue around the retinal tear. It may stand to reason that if something like that happens, if we invite the immune system to the eye to repair a retinal tear, then it might hear a louder invitation and start to form other things everywhere, including an epiretinal membrane. There is some data to suggest that if someone is lasered for a retinal tear, then they're more likely to have an epiretinal membrane. The thing is, it's a mixed picture. A PVD, like I said, is its own independent reason for an epiretinal membrane. Now, the other wrinkle in this whole conversation is that when someone develops a retinal tear, oftentimes the blood vessels of the retina rip as well, and there's bleeding inside of the eye. And one thing we know about bleeding, whether it's in your fingers, your belly button, or your eye, that also stimulates scar tissue to form because the immune system comes to the eye to clean up the mess. And whenever the immune system hears an invitation, it leaves behind scar tissue. Why would the eye be an exception? Ultimately, none of this really matters per se. That is, if someone has an epiretinal membrane, we don't really lose any sleep about it, including we don't go to surgery for it. That is, unless it alters the vision in some way. So if someone has an epiretinal membrane after a PVD, that is without a tear, or with a tear, or with laser, or with bleeding, we just wait around for the epiretinal membrane to cause harm to the vision, if at all. In most cases it doesn't. And if it by chance does, then we do a surgery and take it out. That's it.